You know, every single beat of your heart sends blood on two totally different journeys. One is a marathon and the other is a sprint. Well, today, we're going to explore the heart's unheralded sprinter, an incredible chamber you've probably never even thought twice about.
So let's just start with a quick question. When you picture your heart, you probably think of this super powerful pump, right? But which part of that pump is the quiet, unsung hero of every single breath you take? If you guessed the right ventricle, you are spot on. And that's exactly what we're doing today. We're going to take a guided tour of this amazing chamber, check out its unique structure, its vital job, and why its health is so critical to yours. Okay, first stop on our tour, meet the right ventricle, your heart's antechamber. Before we actually go inside, let's get our bearings and figure out exactly where this thing sits in your chest. So the right ventricle, or the RV as we'll call it, isn't tucked away in the back. Nope, it's right on the front line of your heart. It makes up most of the forward-facing surface, sitting just behind your breastbone. I like to think of it kind of like a protective older sibling, wrapping itself in this crescent shape around its more famous, more powerful sibling, the left ventricle. All right, next section, a tour inside. Now that we know its location, let's step through the doors and really see the lay of the land. And trust me, the RV's internal geography is way more complex and cool than you might think. You know, the first thing you'd notice if you were inside is that it's not just some simple empty room. No way. It's ingeniously divided into two completely different zones, and each one has its own texture and a totally unique purpose. And this really shows you the difference. On one side, you've got the inflow tract. Think of it like a receiving dock. Its walls are all coarse and rugged, covered in these muscular ridges where the blood arrives. But then, on the other side, you've got the outflow tract. That's the launch pad. Its walls are smooth, they're funnel-shaped, perfectly designed to just whoosh that blood out of the chamber with maximum efficiency. Okay, let's go back to those rough ridges of the inflow tract for just a second, because hidden among them is a structure that is so important, it actually gets its own special name. So the official anatomical name is a bit of a mouthful for sure. Thankfully, it has a much cooler and more intuitive name, the moderator band. And believe me, it's called that for a very good reason. This thing, the moderator band, is just a brilliant piece of multitasking. Physically, it acts as a shortcut, a muscular bridge that stops the chamber from overinflating with blood. But electrically, it's a superhighway. It carries the electrical signal that makes sure the contraction is perfectly synchronized. It's literally both the brakes and the ignition all in one. How cool is that? And of course, no tour would be complete without talking about the doors. The RV has two sets of one-way valves. You've got the tricuspid valve, that's the entrance, letting all that deoxygenated blood in from the body. And then you have the pulmonary valve, that's the exit, letting that same blood out on its way to the lungs. All right, on to our third stop, the pumping action. We've seen all the parts, now let's see how they actually work together. This is where the RV truly earns its title as a low-pressure powerhouse. At its core, the RV's job is beautifully simple, but it is absolutely non-negotiable. Its entire purpose is to collect all the used-up, deoxygenated blood from the body and give it one strong, targeted push on its short little trip to the lungs for a vital oxygen refill. Now, to do a job like that, you might expect it to have a super thick, muscular wall, right? Well, here's a number that might surprise you. Its wall is only about 3 to 5 millimeters thick. So why so thin? Well, it's all about the destination. The right ventricle is a low-pressure system. It only needs enough oomph to pump blood to the lungs, which are literally right next door. The left ventricle, on the other hand, that's the high-pressure pump. Its wall is 3 times thicker because it needs the raw power to send that fresh, oxygenated blood to every single corner of your body, from your brain all the way down to your toes. And that brings us to our final stop on the tour, and it's a big one: why your RV matters. Now that we understand its incredibly specialized design, let's explore why that is so important for our overall health and maintenance. So that highly efficient, low-pressure design, it really is a masterpiece of biological engineering. But here's the catch: its greatest strength is also its greatest weakness. See, the RV is a specialist. It's built for one very specific job, and it does not adapt well when the rules of the game suddenly change. So what happens when things go wrong? Well, for instance, if a lung disease creates high pressure, the RV is forced to work way harder, and its thin wall can thicken abnormally. That's called hypertrophy. And if it gets too overworked and starts to fail, blood can actually back up, causing swelling in the body. And what if a hole forms in the wall separating it from the high-pressure left ventricle? The whole delicate balance is just thrown into chaos. So when you think about it, the right ventricle isn't the heart's strongest chamber, but it just might be its smartest. It's a masterclass in efficiency, a low-pressure system perfectly tailored for a really high-stakes job. And it kind of leaves us with a final thought to chew on. What can this incredible piece of anatomy teach us about the power of specialized design throughout our own bodies?